Hi everyone, my name is Joylene Mabika and I am an MPH student in the Health Promotion Program. For this assignment, I have chosen to introduce you all to an organization named Ibis Reproductive Health. Their mission is to drive change through bold, rigorous research and principled partnerships that advance sexual and reproductive autonomy, choices, and health worldwide. I chose this organization because they've been succeeding at this mission for over 19 years. Ibis is a 501c3 nonprofit organization, so they depend on generous donations from donors and grants to do their work. Some organizations that are known to have partnered or financed Ibis Reproductive Health includes the David and Lucille Packard Foundation, the International Planned Parenthood Federation, specifically the Western Hemisphere region, Marie Stopes International, Mary Wolford Foundation, the Society of Family Planning, the University of Texas at Austin, and the Ford Foundation, among many others. Ibis Reproductive Health was founded in 2002 by Dr. Charlotte Ellertson. She wanted it to be a dynamic organization that could bridge academic research and women's immediate health needs. Dr. Ellertson was raised in South Africa and Minnesota and has published over 100 journal articles, book chapters, and commissioned reports throughout her career. She especially focused her work on emergency contraception and medical abortion. In the year 2002, she started Ibis in an unheated church basement with a staff of 3 and grew to have a staff of over 20 people working in Cambridge, San Francisco, and Johannesburg by the end of the program's 3rd year. Dr. Ellertson died of breast cancer in March of 2004 and is remembered by her staff as a brilliant thinker and fearless leader. I wish I could have met her. The work of Ibis Reproductive Health now touches over 30 countries and on 6 continents, all through their offices located in South Africa and the United States. Their regions of focus include South Africa, the United States, Latin America, and the Caribbean, as well as sub-Saharan Africa. Outside of their focus regions, they also work within the Middle East, North Africa, and the Burma-Thailand border regions. For the purpose of this presentation, I will be focusing only on the global health work being done in South Africa. Ibis Reproductive Health keeps their website updated with both complete and active projects. It's very well organized and they respond immediately to any type of concern that threatens women's health. I heavily recommend you checking out their website and reading some of their published work. One of their completed series of projects with the most measurable impacts in South Africa relates to medication abortion. In 2003, Blanchard, Fawn, and Laba, all Ibis employees, published a peer-reviewed article entitled "Abortion Law in South Africa: Passage of a Progressive Law and Challenges for Implementation." This article explains South Africa's complex relationship between progressive laws and unmet needs. In 1996, the Choice on Termination of Pregnancy Act was passed. This policy is exactly what it sounds like. It was a massive victory for women's health and reproductive rights. It provided a framework for women to exercise their right to decide whether or not to continue a pregnancy. This article was instrumental in pointing to issues of access, lack of institutionalization, and integration of abortion into other health services, and a lack of awareness as the primary reasons the passage of the act was not sufficient. The article pointed to a need for research and advocacy to increase access to abortion services, change of attitudes among healthcare workers and in communities, and a need for inclusion of health services at the primary care level. On the topic of medication abortion, Ibis Reproductive Health conducted a survey in 2006 with private physicians in South Africa to identify how they were providing abortion services to their patients. They published their results in the European Journal of Contraception and Reproductive Health Care, highlighting that the physicians and staff find the method quite acceptable and patients seem to like the method in comparison to surgical abortion, of course. In 2015, Ibis Reproductive Health continued to create radical research examining the feasibility of introducing medication abortion into existing public sector surgical abortion services in KwaZulu-Natal in South Africa. They sampled 1,167 women who were seeking first trimester abortions at 4 clinics and found that 94% of eligible women actually chose medication abortion when they had the option of that or surgical abortion. Medication abortion was successfully introduced with low and acceptable rates of adverse events, and 98% of women said that they would actually recommend this method to a friend. In 2016, Ibis Reproductive Health did the same research with women requesting second trimester abortions, recording women's experiences before and after they received services. In 2017, Ibis continued to conduct a descriptive study on the experiences of women in Cape Town, South Africa, who have sought informal abortion services. A striking majority of these women were sex workers and had a higher risk of HIV/AIDS or abortion-related mortality. And the study identified the need for abortion trials and research studies to include people that do not regularly see a doctor, don't generally have access to public sector healthcare. In 2018, another study was done by Ibis Reproductive Health to estimate the costs of public sector abortion provisions and explore the potential for expanding access at a reduced cost. They found that through shifting the methods provided, South Africa actually has the ability and capacity to provide more safe abortions for less money, and they proved that with their research. This is only a few of Ibis Reproductive Health's many published research articles on medication abortion in South Africa. Alongside all of this research, Ibis Reproductive Health has been informing policymakers and healthcare service managers about their research findings, creating policy briefs, and increasing access to education about medication abortion through user-friendly infographics, all available on their website, and physician training guides, which are also available on their website. Ibis Reproductive Health is pretty transparent about what they do, why they do it, and how they do it on their website. That said, I was not able to find information about their specific program evaluation methods. From what I was able to find online, it makes sense that evaluation methods would vary due to the differing contexts of each project, as they tackle different women's reproductive health topics in different countries in different contexts, different types of research, etc. I was, however, able to make countless connections between the work Ibis Reproductive Health is doing and the lessons we have learned in this class so far. The most prominent to me was the approach that they apply to their research and partnerships. They list building and maintaining principled partnerships in their strategic plan as the first thing that needs to be done in order to shift power to communities and contribute to lasting change. I quote from their strategic plan when I say, "We believe that partnerships based on a set of shared principles can most effectively build power within communities and leverage lasting change. We aspire to partnerships founded in principles of respect, mutual accountability, transparent and equitable power sharing, and the use of research results to positively impact people's lives." End quote. Almost all of these points were made in our lessons in this class so far, and I could identify them in the research that I read specifically relating to medication abortion in South Africa. Additionally, as a Zimbabwean, I was actually able to identify multiple traditional South African names, last names that is, belonging to the people conducting the research. And that was exciting to me because representation. Not only is Ibis Reproductive Health focused on partnering with other communities from a basis of mutual respect and accountability, but they are also including community members in all of the work that they're doing. This points to so many principles that we've learned, and I can think of one quote, "Nothing for us without us," that Ibis is clearly doing. They are being intentional about shifting the power into community members' hands and doing all of this from a place of shared dignity and respect. So I am very excited to introduce you all to Ibis Reproductive Health. And honestly, I would love to work for them someday. So I had a great time researching this organization. I hope you all enjoyed.